Assalamu alaikum.
Wa alaikum assalam.
I welcome our team members and especially the distinguished doctors who are joining us, giving us the time for the IMI and ICZ Ramadan healthcare session. And also our community members who are inshallah joining us, and we inshallah will make it very informative, and also we'll try to finish in time. And in that time period, we'll try to definitely help our community to take care of the health, especially during the Ramadan. So I will start with Brother Hassan, please, for the recitation of the Holy Quran.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Ramzan Mubarak to all of you. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Sabbaha lillahi ma fis samawati wal ard wa huwal azizul hakim. Lahu mulkus samawati wal ard yuhyi wa yumeet wa huwa ala kulli shay'in qadir. هو الأول والآخر والظاهر والباطن وهو بكل شيء عليم. هو الذي خلق السماوات والأرض في 6 أيام ثم استوى على العرش يعلم ما يلج في الأرض وما يخرج منها وما ينزل من السماء وما يعرج فيها وهو معكم أينما كنتم والله بما تعملون بصير. له ملك السماوات والأرض وإلى الله ترجع الأمور. يولج الليل في النهار ويولج النهار في الليل وهو عليم بذات الصدور. بسم الله الرحمن الرحيم. لو أنزلنا هذا القرآن على جبل لرأيته خاشعا متصدعا من خشية الله. وتلك الأمثال نضربها للناس لعلهم يتفكرون. هو الله الذي لا إله إلا هو عالم الغيب والشهادة هو الرحمن الرحيم. هو الله الذي لا إله إلا هو الملك القدوس السلام المؤمن المهيمن العزيز الجبار المتكبر. سبحان الله عما يشركون. هو الله الخالق البارئ المصور له الأسماء الحسنى يسبح له ما في السماوات والأرض وهو العزيز الحكيم. صدق الله العلي العظيم. Back to Murtaba bhai. Back to you.
Jazakallah, Hassan bhai. Mashallah, Hassan bhai. हम सबकी तौफीक़ात में इजाफा करे. Let's go again. So I will just request Iba that if you can tell the agenda so that our community members should know that what we are going to have today, and please if you can introduce the panel.
Assalamu alaikum everyone. I'm Iba Sarwar, the moderator of today's Ramadan healthcare session. Throughout this program, as Brother Asim is showing, we're going to be taking questions as well. Sayyid Hadi Yassin and the doctors here with us today will be answering your questions related to health, COVID-19, vaccinations, or any health concerns that you guys have. Feel free to use what you see here on the screen to submit your anonymous questions. And then our agenda consists of, as you heard, recitation of the Holy Quran. And then we have the introduction of the panel experts. Then we have speeches on the COVID-19, the pandemic, vaccinations, etc. And then after that, we have educational information and tips by the experts related to Ramadan and healthcare. And then we will open up the floor to Q&A, and then Sister Shaibano, who is the BOT, will be doing our closing remarks. So inshallah, this will take about an hour and a half or so, an hour or 45 minutes. It's my honor to host all of the knowledgeable and amazing panelists here today. ICZ's resident Maulana, Sayyid Hadi Yassin, Dr. Wajir Rizvi, Dr. Mushtaba Sarwar, Dr. Mubarak Raza Naqvi, Dr. Hassan Jafri, Dr. Fatima Madani, and Dr. Iqbal Rashid. And then today's first speaker is Dr. Mushtaba Sarwar. Dr. Mushtaba Sarwar, MD, FACP, is an internal medicine doctor working as a hospitalist in Modesto, California. He works in the COVID-19 unit at Sutter Health, and he's prepared some slides for us all today. And please come up and present whenever you're ready.
Sorry, I think it's, let me start from this. Thank you, Iba. Mashallah, let me start from here. The ICZ,
Dr. Sarva, you're not sharing your slides.
can you guys see that one?
No, you have to click on share one more time in Zoom.
Can you see it? Sorry, just let me start from the, okay. Oh, I think from the start. Can you see it?
Yes, we see
Sorry
it.
for definitely for inconvenience. I'm sorry, I'm not very good in this one. I try to be. Thank Asim Bhai for definitely help. So I start with this disclaimer. We, the ICZ, mashallah, every year and this year with the IMI, we're also managing this Ramadan healthcare session. And so we want to definitely give the information and also about the tips so that we can have our fasting according to our healthcare. But let me tell this thing that this, all the information, whatever is there, I just start with this disclaimer. This Ramadan healthcare session is purely for educational and informative purpose only. Any healthcare related suggestions or information given in this session by the expert panel should not be considered as a medical advice. Please consult your doctors for any medical advice before you make any changes in your medications. Again, so I have the privilege to talk about the general things about the healthcare. The objective of this Ramadan and healthcare education session that we want to understand about, definitely make sure that we understand about our medical conditions. Everybody has their different medical condition like diabetes, high blood pressure, any heart problem. So it's basically what we want, that we want to make sure that we understand our medical condition, because if you are fasting, if you are taking different medication, it has to be according to your medical condition. Everybody is different. And relevant to that one, to get advice from your healthcare provider so that you can make the decision whether you can fast. And if you're fasting, how can you can manage your medical condition during the fasting, like, and everything, whatever you have to take care, please make sure you take care according to your healthcare providers. We all know that fasting is a religious and a spiritual practice. And again, going the same thing, that please make sure that we understand about our medical condition, because whatever medical condition we have, whatever the medication we are taking, it has to be understand that what are the risk of those conditions. Like for the diabetes, we know that definitely we are taking medication, we would be fasting, we would not be eating the whole day, and there's a risk of hypoglycemia and definitely other risk, So how we can minimize the risk of those conditions? Again, please, I want to emphasize on this thing that's very important for us during fasting. And that's the thing, my objective and our objective of this healthcare session, this one. Please get the advice from your healthcare provider, and according to the advice, according to the medical condition, we have to organize. And like, for all daily activities, for all different our works, we always organize, we make some changes. We know that we have to get up early morning to go to work and this. And so the same thing, if we are fasting, if we have a medical condition, please make sure that we organize according to that what time we have to take the medication, which medication, according to the consultation of your primary care doctor, we can make the changes in the timing, in the dosing, and that will help to reduce the risk of those medical conditions. And again, we have to individualize the plan. So every plan, whatever is there, cannot be same for everybody. So whatever we can see, the information from the somebody used that good word. I like that one, that Dr. Google. So you can definitely get a lot of the information, but make sure they individualize your plan, not just for all the diabetic patients will be same, because like diabetic patient, they are taking different medication. Somebody is taking insulin, somebody taking oral medication. So it has to be individualized according, not only to the, according to your medical condition, it should be according to your definitely the medication and the other schedules, And the pre-Ramadan medical assessment is always important. I know we already have started the Ramadan. Maybe still, I think never we are late to get the right thing. So I can say that one, that we should know about our physical status, weight, blood pressure, again, diabetic glycemic control, whatever we are taking, all those ones. And again, whatever we are doing, please suggestion, whatever you're making, make it according to the professional supervision of your primary care doctor. The same thing, the definitely in the Ramadan, our assessment, all these activities of the life, medication, whatever you have to do, please make sure that we organize according to that one. In every year, we say that one, that if we have to organize, if we have to make some changes, definitely we know that it has to be generally counseling and teaching all these things. It should be taking place not on the day of the starting of the Ramadan. It should be at least 1 or 2 months, So I hope that we keep this message. Inshallah, Allah Ta'ala bless the Ramadan to all of us next year, inshallah. And then hopefully this will also work for the next year. So we should organize definitely pre-head and before time. We all know that the fasting is our spiritual and the religious definitely practice. But the studies has shown, and that's the thing I want to highlight, that fasting has a lot of the healthcare benefits. Definitely we get a lot of the rewards by the religious means, but definitely it also has a lot of the healthcare benefits. And I tried to just place few things in my slides. And also the studies has shown that wide array of the potential health benefits. There are a lot of the potential health benefits, including it improved blood sugar control. Our distinguished endocrinologists, Dr. Fatmi and Dr. Waji are there. And I know that they will agree and they can emphasize on that one, that fasting can, we know that we are a lot of the different things, that diet control, taking medication, even the fasting can help us to control our the blood sugars, especially in reducing the insulin resistance. The same thing, cardiac related, health. Brain functions, we all need that one. Cancer prevention, definitely. I hope that we always prevent from the cancer and other diseases. And it can also help for the cancer prevention. So one thing I just put in that one, again, my experts are there, endocrinologists, that fasting drops insulin level and it increases growth hormones. What's the benefit of that one? When the insulin level is decreased, when the growth hormones are increased, it facilitates fat burning, which I think I can use that word, is one of the toxin, And also it also gives us the muscles gains, that's the thing we want. That's definitely to be healthy. We don't want fat, we want muscles gains, The most important being a internist, I can say that one, the base of all the diseases, from my point, I can say is the inflammation. Like we are dealing nowadays with the coronavirus. A lot of all the whatever we have things happen in the coronavirus is the inflammation. That's why we keep monitoring I work also in the corona like a virus, COVID floor. We also keep on monitoring our like inflammation markers like CRP and other thing. The fasting, which I want to emphasize, that fasting, it can decrease the level of inflammation. And how it can decrease? It is reducing the cytokines, and that also promotes our healthcare, So decreases the level of the inflammation. It's not only for the coronavirus, for the rheumatoid arthritis, for other definitely the medical condition, which can have a lot of the adverse effects because of the inflammation. So we can decrease our inflammation. It promotes wound healing, We take a lot of the medication like antibiotics, all these things. And even just fasting, it can wound healing. I just have given the recent review that in the nutrition in 2019, calorie reduction, it reduces biomarkers of aging. It's a good news for not for all of us, but many of us. So calorie reduction reduces the biomarkers of the aging. It has a 2018 steady cell metabolism. So you can see that definitely fasting is not only gives us the religious benefit, it gives a lot of things, even gene changes related to the longevity and the protection against diseases, So there are a lot of the definitely things happens according to our gene changes. Try to be definitely minimize about the benefits and about the fasting, but definitely it can boost brain functions, neurodegenerative dysfunctions. It helps reduce the weight. We all know that one. If we do it properly, that's also important. Spiritual benefits. I think I cannot talk. Inshallah, our resident scholar Hadi Yasin, she might be joining in that one. He can tell us that the benefits, but it increases our gratitudes. We know that when we are fasting, it also helps us to our deeper faith. It improves awareness, We all know that by fasting, we have awareness about the people who are hunger. They know how your thirst can feel you. So it can improve our awareness, So there are a lot of the things it can happen. And if we have awareness, we know that we can get more benefits. I'm not going to talk much about that one, but definitely at this time, because of the COVID, we are dealing with this coronavirus, and most of the thing what we try to this one, and that's the thing, we are also getting the vaccination, that we have to boost our immunity. And there are a few things our definitely Dr. Fatmi, she will tell us more about all the diet. Keep diet to boost your immunity. Again, there are a lot of the diets. I'm not going to in detail about those ones, but definitely make sure that we are having our balanced diet. Divide food and meal, all these things like midnight. I think definitely we are having iftar. We know that we should have this, but also we can have something on the midnight. Please do not skip your suhoor, especially diabetic patient, because there's always risk of more hypoglycemic events. Also, definitely, there may be weaknesses. It can make you dehydration. So please don't skip your suhoor, Balanced diet. Again, I'm not going to talk about that one. Try to be rich in vegetables. Take other things, fruits. These are things, again, I will not go in detail of those ones. Oils. We can make healthy oils in our cookings now. Sleep, especially night sleep. Please, nowadays, especially in Ramadan, I know especially our youngster, they don't sleep, especially up to suhoor, whatever they're doing, but make sure that we are having a proper rest and sleep. And what the recommendation, like at least let's go with the 6 to 8 hours, sleep. The important things are there, but one thing I want to highlight again, according to the present, that It helps in our immune systems, and that protect from your health issues, heart disease, diabetes, obesity, Exercise, definitely very important, but make sure that we don't exhaust ourselves. We don't ourselves to get dehydrated. I think whatever I highlighted, but definitely take home message are this one according to the healthcare tips. Please do not skip your sir. I know it's very hard to get up, especially when we are going to sleep late, but please still, it's very important, especially for the who have a underlying medical condition. For those one, again, being a physician, our panel, they can also emphasize on that, please. And even from the religious point of view, our resident Hadi Yasin, that can also emphasize on that, please do not skip your sahur. And always avoid simple other things, which definitely should not make us dehydrated. So the sahur is also important according to your diet for the health. Again, being a physician, I will say that please do not forget your medication. These are my health tips, The reason why we don't want to forget our medication, but during first Ramadan, it is so important because after Sahur, we know that we cannot take our medication. Like during other days, if we miss our medication, we know that we have a time, we can take any time, but this time we have to more concentrate. Do not forget your medication, whatever you're taking. If you're taking some medication at iftar, yes, you will have a time, but definitely you don't have a full span of the time. You don't want to overlap your medication. If you keep on skipping the time from the iftar up to the midnight, and then you have to take your medication again at the source. So please make sure that keep in mind, make this tips on your hand. Do not forget your medication because you don't have the span of the time, whatever and time you can take it, At the iftar, yes, we have to keep our healthy diet. Again, I always say that pakora, all this thing, avoid fried food, prefer low fat and adequate protein. Again, Dr. Fatmi will tell us. Iftar, please do not drink very cold water. Nowadays there are some places it is definitely very hot, especially India and Pakistan and other places. But definitely, please do not drink very cold water. And we have a very good, definitely from our nephrologist, distinguished Dr. Deep Rizvi, he also emphasized that please don't drink very hot water. Definitely, it is not good for your kidneys. Keep yourself hydrated. Please make sure again that we definitely don't get a chance to drink a lot of the water, but hydration is always important. Even for the coronavirus, Dr. Hassan also can emphasize on that one. Hydration is very important, especially if you are going to take your vaccination. On that day, especially, please make sure that you are hydrating yourself, because again, when you go for your vaccination, you cannot drink water after that. So hydration is very important always. During this time period with the COVID, especially if you're going to take your vaccination, make more attention to keep your hydration. Again, fasting, it can control our hypertension, blood sugar. So a lot of the benefits from the fasting, which I told in the start. Exercise is important. We all knows one, but make sure don't fatigue yourself, don't tire yourself, and also avoid dehydration, because again, it's not that you are exercising and come back and you can have a water. You cannot have that one. So you have to make sure that you exercise not up to the point that you get your dehydrated. Again, proper rest and sleep at least 6 to 8 hours. So I will not go in detail of this one. So please, definitely thanks, Iba, and then we can have our next speakers. And again, thanks again for the opportunity to tell about all these healthcare tips. Thank you.
Jazakallah, those are really good reminders, especially the bit about fried foods like pakoras and such. I'm sure we all needed those reminders during this month. So our next speaker is Dr. Hassan Jafri. Dr. Hassan Jafri is our infectious disease specialist, so we're really privileged to have him today. He has to prepare some points for us today, so I would like to request Dr. Hassan Jafri to present whenever you're ready.
Thank you, Eva. Assalamu alaikum, everyone, and Ramadan Mubarak. So I'd like to actually just summarize and review with you some of the updates that are available now to all of us for prevention as well as treatment for COVID-19. So, of course, currently in the United States, there are 3 vaccines that are currently authorized under emergency use by the United States FDA and CDC to help us prevent COVID-19 infections. On this table, the first 2 on the left side are from Pfizer and Moderna, and they're unique because they both share the same technology referred to as the messenger RNA technology, or mRNA. The third one is by Johnson & Johnson, and that uses a more traditional vector platform. The Pfizer vaccine is unique in the sense that it included individuals 16 years of age and older in the clinical trials, and that's why it's currently approved for 16 years of age and older, whereas Moderna and Johnson & Johnson vaccines are approved for individuals 18 and above. Both Pfizer and Moderna vaccines require 2 doses to complete the vaccination series. Pfizer doses have to be 3 weeks apart at least, whereas Moderna vaccine doses have to be administered at least 4 weeks apart. Whereas Johnson & Johnson vaccine has been authorized for a single dose to provide complete immunization. I think it's important to think about the effectiveness or efficacy of these vaccines, thinking about the serious illness, because you see a lot of different rates being thrown around. So I want to focus on serious illness, which basically reflects individuals needing to be hospitalized, someone who needs to, who cannot really breathe on their own, and therefore they have to be put on the ventilator in the ICU, or even require this oxygen in the hospital, even if they're not in the ICU to breathe because their lungs are not working as efficiently. So when you compare the 3 vaccines, what you see is that they're all excellent in terms of having efficacy against prevention of serious illness. Pfizer is 95%, Moderna 94%, and Johnson & Johnson 85%. Now, I think it would be oversimplifying just to compare these numbers, because I think what one also has to think about is the time and context in which these trials were done. When the trials with Pfizer and Moderna vaccine were conducted, it was much earlier in the pandemic, and therefore we were not seeing as many of the variants that now we're seeing. And at the time when Johnson & Johnson trial was conducted, many of those variants were actually already observed. So that takes into account the different efficacy rates, because we know that even Pfizer and Moderna, they're not as effective against some of the new variants as they are against the original COVID strain. But remember, one rule of thumb for all vaccines, that they would be excellent as long as the effect is 70% or greater. So as you can see, they're all excellent vaccines. The potential side effects for all of these vaccines are actually quite typical for any other vaccine that you may have received as an intramuscular injection. You're talking about pain at the site of injection. Sometimes you may get fatigue, some headaches, some fever, maybe body aches, and sometimes even chills. One other thing that it's important to remember, that you would only be considered fully vaccinated after it has been at least 2 weeks since the last of the doses. So if you're taking any of the 2-dose vaccines like Pfizer and Moderna, it has to be at least 2 weeks after the second dose that you would be considered fully vaccinated. Whereas it would be after 2 weeks from the single dose of Johnson & Johnson that you would expect to be fully vaccinated. And that basically just takes into account the fact that it takes at least 2 weeks for the immune system to mount adequate amount of antibody responses. So I wanted to talk about a few recent developments and considerations that I think you all, I'm sure, have been reading about in the papers. The first thing is about the new variants of COVID-19. We know that viruses continue to replicate, they continue to mutate also. Sometimes, most of the time, the mutations are not really substantial enough, and therefore all the medicines continue to work, the vaccines work, but we know that some mutations could be substantially greater, and therefore they can pose greater challenges to medicines, including vaccines. So what we are aware of is that there's a UK variant, there's the variant strain from South Africa, and there's also the Brazil strain as well. And by the way, there's also a California variant as well. So why are they important? These are, I mean, it's not that COVID doesn't have other variants, but these are the major ones that do respond slightly differently or behave differently enough from one or the other. So one of the things about the UK strain is that it is it's highly contagious, a lot more contagious than the original COVID-19 strain. So it makes it much easier for a COVID-infected patient to transmit it to a non-COVID infected patient. So that's why it's become a major challenge. The South African and Brazilian strains, they're important because they're not as responsive. The new medications that are being developed, as well as some of the vaccines, are not as effective against these strains as they are against the UK variant or the original variant. The vaccines still work against these, but I think this is an example of where the viruses are always one step ahead of us, and we always are trying to catch up or trying to predict what they will do next. The other thing is duration of immunity. We know that vaccines typically are expected to provide protection for several years, right? However, this is something that we need to find out for the COVID-19 vaccines. And the reason primarily is that most of the time when vaccine trials are conducted, they're conducted over many, many years. So before a vaccine gets approved, we know fully well, after the individuals who've been in the trial have been followed for sometimes, 2 years, sometimes even 5 to 6 years, that how long the protection would last. However, because of the urgency due to the pandemic, as you all know, COVID-19 vaccines were approved soon after the data were available. And for most of these vaccines, patients, the volunteers who had participated in the trial had only been followed for 2 to 3 months. So we knew that the efficacy was great at 2 to 3 months, but we will learn as we follow these individuals longer. So, for example, recent data suggests that Pfizer clinical study participants are protected at 6 months. And this is not to say that they would not be protected longer than 6 months. It's just that now they have been followed up to 6 months. So longer follow-up is ongoing for not only Pfizer, but all vaccines, and will over time tell us about how long will the protection last. However, there is a slight possibility that we may need to get some booster vaccine doses in future. We don't know yet, but it may be needed. Something like, we do this with influenza, where we need it once a year to cover for a longer duration of protection, or to cover more of the new variants. So, but this is a speculation. Right now, there's no booster that's available, but it is definitely possible. And of course, the other thing that I'm sure you're all aware of is that Johnson & Johnson vaccine has recently been put on hold by the FDA and CDC out of, as they called it, abundance of caution, to investigate reports of 6 cases of blood clots in patients out of almost 7 million people who have received the dose. So it's clearly an extremely rare event. And currently, everyone is awaiting the outcome of the investigation on whether these cases might actually be due to the vaccine, or could they be simply a coincidence. But I think this also shows how effective the follow-up system is in the United States, because this is how extremely rare events, even if there's an indication before you know whether they're true or not, you can identify them, and then the system basically actively investigates them. So we'll find out, but until then, Johnson & Johnson vaccine is no longer available for people to be dosed. So right now, it's only Moderna or Pfizer vaccine. So one thing, so we've been talking about vaccine, which is really to help protect us from developing a COVID-19 infection. But what if I develop a COVID infection? Well, the good thing is that most cases are really mild or moderate, and they get better on their own in about 5 to 7 days. And most of the time, you're really having to take like Tylenol for body aches or fever, as Dr. Mustafa said, already mentioned, you want to make sure that you're drinking plenty of fluids. And I'd like to just point out 2 important concepts: isolation and quarantine. Isolation the term is used for individuals who actually are infected themselves. quarantine is the term used for people around them who don't have the infection but have been exposed to them. So if I develop a COVID-19 infection, I need to be isolated from my close contacts for at least 10 days and until I have not had any fever for at least 1 day, right? So at least 10 days, but maybe longer if it takes me longer, many more days to get over my fever. However, all of the household and or close contacts need to be quarantined, and they can be tested after as early as 5 days from the last exposure. And if the test is negative and they still don't have any symptoms, then their isolation can be, their quarantine could be ended by 7 days. However, if they're in a place where a test is not available, so as long as they have no symptoms, their quarantine could be ended after 10 days. But there are certain individuals who are really at high risk for developing serious and severe complications of COVID-19. For example, they may end up needing oxygen because they cannot breathe on their own. They may need to be hospitalized. They could even be as sick to require a breathing machine to be put on in the ICU. These risk factors include age above 65. They also include other health conditions like heart disease, high blood pressure, diabetes, kidney problems, asthma, chronic respiratory problems, as well as cancer. Morbid obesity is also a risk factor for serious or severe complications of COVID-19. Similarly, in older children, conditions like congenital heart disease, neurodevelopmental conditions like cerebral palsy, and children who require chronic devices like tracheostomy or feeding tubes, they're also at risk. So what do you do for those? Well, the good thing is that if we can act quickly, there is treatment available. And that treatment I wanted to talk about is monoclonal antibodies. Okay, so first of all, what are antibodies? Antibodies are basically the proteins that our immune system makes to keep us protected from infections. The reason why we administer vaccines to people is so that in response to the vaccine, the immune system will develop the antibodies and therefore the immunity. However, monoclonal antibodies can also be manufactured, and they're highly active compounds that are derived from patients who have survived COVID-19, and then you can manufacture them and make them in very large scale. So this essentially represents pre-made antibodies. So therefore, in a patient who does not have the antibodies already, and you don't have time, you can actually give them a dose of the pre-made COVID-19 antibodies. These are highly effective, and they work very well to stop progression of COVID-19 as long as they're administered within the first week. And the other thing is that they have to be administered through the vein, so intravenously, which the process takes about 2 hours. So there's a bit of a planning that needs to be taken. Currently, there are 2 monoclonal antibodies that are authorized for use in the United States for treatment of COVID-19 patients. And these patients, there are strict criteria. They cannot be in the hospital yet. So these are really for mild patients who are not requiring oxygen for COVID-19. They have to be within 10 days of the start of their symptoms, and it can only be given to individuals who are at high risk for developing serious COVID-19. That's the list that I presented to you on the previous slide. However, it can be given to COVID patients regardless of whether they had received vaccine or not. So even if they had received a vaccine, but they have a breakthrough COVID infection, as long as they meet the high risk criteria, then they can receive the monoclonal antibody. And the other thing is that since these are human antibodies, they are very safe. So if a patient has COVID infection and the patient is still not in the hospital, it's best to call the Health and Human Services hotline at, I have the number over here. And by the way, I've actually tried calling this number. They're extremely helpful and extremely knowledgeable. These are the operators who you speak to directly, who will screen you on the phone for any of the risk factors, like what's the age, if you have any other illnesses like diabetes, other things, are you having any difficulty breathing, so on and so forth. If the patient falls within the high-risk group, then they provide the contact for an infusion center in the patient's geographical area. If the patient, however, does not fulfill the high risk criteria, then they can offer a chance. They can be offered a chance to participate in an ongoing clinical. I just put in, Pleasanton, California, and it just pulled up within 30 miles. Look at all the blue dots. It tells me, how many, and you can actually change it based on the zip code or where one is, within 50 miles, 15 miles, 100 miles. By the way, these antibodies are currently only available within the United States. They're not available in Canada or any other country in the world so far. So just to summarize, what do we need to do? Well, we need to get vaccinated ASAP. And I would like to remind everyone that vaccination, as long as it's intramuscular during fasting in Ramadan, is permissible according to Ayatollah Sistani as well as Ayatollah Khamenei. We have to continue to wear masks and observe social distancing. We have to just remember, we have made a lot of sacrifices and may have even endured loss of loved one due to COVID. And therefore, we cannot let our guard down this one. We've come too far. But the good thing is that once we get vaccinated, the CDC has recommended that fully vaccinated individuals can meet indoors without masks and without social distancing. However, we have to use caution and common sense and avoid meeting people if we have any signs and symptoms of respiratory infections. And then, as I mentioned, in case of a COVID infection, we need to make sure that people consider getting evaluated for monoclonal antibody treatment. So with that, I'd like to stop over here and thank you all for your attention. And I'm sure we'll have time to discuss during the Q&A session. Thank you.
Thank you, Dr. Hassan Jaffer, for the interesting facts on vaccinations. I know a majority of us are getting, at least in California, are getting vaccinated and looking to get vaccinated as soon as possible. Before I call up the next speaker, I just wanted to quickly show the QR code again for the questions. I hope you guys can all see my screen. So we're still accepting questions. If you guys can scan your QR code on here, or you can also look at the site here and then you can put in the code, which is 786. I'll give you guys a quick second. Okay, so I'll show this slide again after our next speaker. Our next speaker is Dr. Fatemeh Madani. Dr. Fatemeh Madani has trained at University of Davis for an endocrinology fellowship, and she is currently practicing as an endocrinologist in San Jose, California. And she has prepped a quick 10-minute speech for us all today. If you can please come up and present your speech whenever you're ready. Thank you.
Assalamu alaikum, Ramadan Mubarak. Today I'm going to be talking about the health benefits of fasting, some healthy food options during Ramadan, the way to kind of control our portions using the plate method, the benefits of exercise, when to exercise during Ramadan, foods to help boost our immune system. As Dr. Sarwar mentioned, this slide is usually for tips and advice, but does not replace your doctor's recommendations. Fasting during the month of Ramadan consists of not eating or drinking during the hours of sunlight for a period of about a month. It's one of our main pillars of Islam, and the reason to fast is spiritual, as an act of worship, a chance to be closer to Allah, to practice self-discipline, and to give back to those that are less fortunate and give charity. There are many studies now that have come out due to the interest in intermittent fasting, many studies available that show the health benefits of fasting, including body weight. So during Ramadan, we can lose weight and decrease our body fat. However, this only happens if we're restricting how much we're eating. So if we eat more than the other months, then we won't lose any weight. But if you're eating a little bit less, then you can lose weight and decrease your body fat. It helps to lower the bad cholesterol and increase our good cholesterol. With sugars, it helps to improve our glycemic control by helping our bodies become more sensitive to the insulin. It helps our immune system by reducing the oxidative stress and decreasing our inflammatory markers. And our brains helps with memory and brain function. But some may ask, why then at the end of the day do I feel so bad after fasting? It's not really helping my memory. And so one of those main factors is the types of foods that we're eating, the amount of food that we're eating, how much we're sleeping, whether or not we're active during Ramadan or not, and our fluid intake. And if you have a medical condition or take medications and you decide that you would like to fast, it's a good idea to discuss this with your doctor. So as we mentioned, fasting is a great way to reset and detox the body. It's very important to replenish our body with the fluids during the times that we can eat during suhoor and iftar by eating fruits and vegetables and drinking lots of water. If you have a healthy heart and kidneys, it's recommended to drink at least 2 to 3 liters per day. And also limiting our coffee and caffeine intake, as these can be diuretics. Here are some foods, vegetables and fruit that are very good with helping our hydration, as seen here. So during suhoor, it's a sunnah to have suhoor, and this is our nutrition prior to fasting. So when we're eating suhoor, we want to have some complex carbohydrates. So the white refined carbohydrates are not as good because when you're eating the complex carbs, it'll help you feel full longer. So some of these are brown rice, whole wheats, quinoa, oatmeal, oats. Protein helps us maintain our muscle during Ramadan. So eggs or meat, and don't forget about the beans, lentils, chickpeas are also a good source of protein. And also yogurt. Some of our low-fat dairy products are really good with protein. Fruits and vegetables are a good source of fiber and give us vitamins and minerals. And then we should try to drink at least 2 to 3 glasses of water for suhoor, and perhaps take a multivitamin for a boost. Healthy, unsaturated fats like avocados and unsalted nuts are also really good. And we should definitely avoid cereal. If anything you can do is avoiding cereal, since these are broken down into sugar and insulin is released into the bloodstream. And if you notice after eating cereal, a couple hours after suhoor, when you wake up, you'll feel very hungry with the cereal. So what are some options? Definitely we can do leftovers if that's something you like, leftovers from iftar. Or if you like breakfast foods, there are many options such as overnight oats, oatmeal, halim, shakshuka, eggs, potatoes, spinach with bread, avocado toast, banana peanut butter, or smoothies. Iftar, the main point about iftar is that it takes us about 15 to 20 minutes for our bodies to actually register that we're getting full. So we need to slow down when we're eating. And one way to do this is to eat lighter foods when we open our fast, and then afterwards have a good balanced meal for iftar. So you can have dates, fruit, and some water, and then you should go for prayer. This gives you some time and also for your brain and also your spirituality to be able to then handle the bigger meal that you're going to have. And so when you decide to eat iftar, you want to use your plate by looking at half of a plate of vegetables, 1/4 of the plate can be carbohydrates, 1/4 protein. For healthy protein options, you can use grilled or baked lean meat and the beans as well, vegetables, fruit, and making sure we're drinking at least 2 to 3 glasses of water. You should definitely avoid any fried or processed foods and enjoy the food so that we're not overeating by eating slowly. As more people are getting vaccinated, we might be iftaring outside of the home. And if we're doing that and you don't see a lot of veggies, have more protein. If you see that there aren't any healthy carbohydrates, you might want to eat less of those non-healthy carbohydrates. You still should have some carbs, but eat less in portion. And if there's fruit, you can have an extra serving of the fruit. After iftar, if you're hungry and want a snack, consider a protein fiber, rich snack. Energy bites, which have dates and almonds and coconut, are really nice. Or you can make a nice veggie platter and have hummus, and definitely make sure to drink another couple of glasses of water and fluids. For helping us with portion control, the plate method is used, meaning that you look at your plate, you divide it in half, and 50% of it or half of it should be vegetables, a quarter or fourth protein, and then a quarter these complex carbohydrates. Things to avoid. So our bodies sometimes, we're hungry and we see and smell foods, and so you want to avoid these deep fried foods, which can really cause us a lot of fatigue and have our body work much harder to try to process these foods, such as our samosas, our fried chicken, our spring rolls, potato chips. Also the high sugar foods we should try to avoid as well. Switching gears to exercise. So exercise during Ramadan has been shown to be helpful and beneficial to us. If we can do 30 to 45 minutes of exercise 2 to 4 times per week, or you can walk, 10 minutes per day, is been shown to be very beneficial to our bodies. We want to avoid aggressive or high intensity exercise, especially in the hot weather, which could lead to dehydration. And we want to consult our doctor before starting any regimen. For example, if you're starting to run, if you're not really a runner, it's probably not a good idea. And then making sure that we're drinking a sufficient amount of water between iftar and suhoor to make sure we're not dehydrated. The best time to work out depends on your schedule, so everybody might be different. Some like to work out or exercise in the middle of the day. That might take some time to get used to doing. Some like to wait a little bit before iftar, that way you have access to water. However, that could be difficult for some people since you probably have to get ready to make food, and probably you're working, so that might be difficult. You might be tired. Some people like to exercise after iftar. You want to be careful about it being too stimulating for you in terms of activating you and not being able for you to be able to sleep at night. So there's kind of different ways of exercising and times, but whatever works best for you is good. It helps with our overall health, with energy levels, our strength, our mobility, and also mental health benefits in reducing stress. Immune boosting foods. So we have vitamins and supplements. However, the best way to get these supplements are actually through our food. Our body absorbs and uses these vitamins better. And so certain foods that are immune boosting you can take are yogurt, black seed, and manuka honey. The fish and nuts are excellent source of selenium. Garlic and onion have antimicrobial and immune boosting properties. Turmeric is also really good. And then foods, during this COVID time that are helpful are, I've kind of listed them out based on the minerals that they have a lot of. So zinc containing foods, selenium containing foods, our vitamin A foods, a lot of dairy, vitamin B6, vitamin C, the citrus fruits, and vitamin D, our cheese, milk, eggs, and salmon, and then our vitamin E containing foods. So to recap, fasting is a good way to reset and cleanse the body, and also enhancing our spirituality. Eating a healthy diet will help us during Ramadan. So making sure you're hydrated and also staying active. And if you have any medical conditions, definitely discussing this with your physician. Okay, I think that's my presentation.
Thank you, Dr. Fatima Madani. Those were excellent reminders and tips on nutrition for everyone present today, especially during Ramadan. Just once again, let me share my screen really quickly. Oh, sorry. Can you stop sharing your screen real quick so I can?
Yes, I'm trying to make my screen bigger. Oh, let's see. How do I do this?
Sister Eva, go ahead, share. It'll unshare what Sister Fatma is sharing.
I'm sorry?
You can go ahead and share your presentation or your slide, and it'll unshare.
Oh, here we go.
Oh, got it. Okay. Okay, so here is the QR code again. We're still taking lots of questions. We're getting a lot. Nutrition-based, vaccination-based, pandemic, anything with health concerns. So I'll give you guys another second to look at this. The code is also 786 if you want to go to the website, or you can scan the QR code. Okay, so our next speaker is Dr. Mubarak Raza Naqvi. Dr. Mubarak Raza Naqvi is the global president of Imami Medics International, the organization that we are collaborating with today. He is also the medical head of insulin-based therapies at Sanofi. Additionally, he has worked as various leadership positions in clinical research and medical affairs in the United States, Europe, and in India. Dr. Mubarak has put together a quick 10-minute speech for us on some important points, and I would like to request him to come up and present, please, whenever you're ready.
Thank you, Eba, and Assalamu alaikum, everybody. I'm reaching out to you from Mumbai, and it's a pleasure, and thank you so much for this opportunity. Can you see my screen?
Yes, we can see it.
Right. So I will be addressing a few commonly asked questions from diabetes and Ramadan perspective. Before we go to the Q&A, I would just like to highlight a very small fact here. In Ramadan, when we are fasting, on the left-hand side, what you see is a healthy person's glucose profile throughout the day. And on the right side, you see a patient of diabetes. What you see here is that just at the time of iftar, compared to somebody who's not fasting, the purple line is a person who is not fasting. Compared to that person, there is only a small dip just before iftar, and then there is a small peak immediately after iftar, the fasting and feasting phenomenon that we see. On the other hand, on the right side, in a diabetes patient, what you see is that just before iftar, the sugar dips quite a bit, and immediately after iftar, the sugars rise up a lot. So there is a hypoglycemia as well as a hyperglycemia happening at this point in time. This is what is the aim of the doctors to prevent, because we want these lines to be as flat as possible. Neither we want our patients to go in hypoglycemia nor in hyperglycemia. Therefore, your diet, your medications, and for the physicians who are in this group treating diabetes patients, the goal for the treatment of your patients is this. Now coming to the Q&A, first of all, the most often asked questions, and one of the brothers addressed it briefly, is that what is the learned advice of our Islamic scholars for diabetes patients during Ramadan? First question is, can people with diabetes fast? Yes and no, depending upon the risk categories, which we will discuss in the next slide. Can we take oral medications? These can be taken, but they can be taken after iftar and until suhoor, not when you are in the state of fasting. Can we inject insulins in the state of fasting? Yes, the injection of insulin is permitted by most Islamic scholars, even during the state of fasting. You don't have to restrict yourself to inject insulin just after iftar and before suhoor. You can inject it any time of the day, even when you are fasting. And can we perform blood tests in the state of fasting? Again, the answer is yes. Blood tests are permitted by most Islamic scholars. Finger prick tests as well as the blood drawn from a vein, both are permitted as long as the quantity that is being drawn at the time of a venous test is not large enough to affect the general health of the patient, which is not the case because hardly 5 ml or 6 ml blood is drawn even for a blood test. Now, I won't go into the details of this slide, but the clinicians in the group must be familiar with the Diabetes and Ramadan Alliance of the International Diabetes Federation. And IDF DAR have released detailed guidelines. Their previous version was released around 2016, and the most recent one is released this year itself. And the 2021 Diabetes and Ramadan guidelines give a very detailed account of how to manage diabetes during Ramadan, what to do, what not to do from a dietary perspective, from a treatment perspective, from oral medications, insulins, all the details are there. And I would highly recommend the clinicians to refer to these guidelines in order to treat their patients. Broadly speaking, there are multiple factors to be taken into account. And then based on the risk, it is stratified as low risk, moderate risk, or high risk. And the medical opinion generally is that high risk patients should not fast. The moderate risk patients are advised not to fast. Many patients in this group, however, want to fast, so they should be monitored very closely. And even the low risk patients who can fast, but with necessary medical supervision. And I have given the reference to the DAR Alliance and the DAR guidelines at the bottom of the slide. In this particular development of these guidelines, the religious authority they consulted was the Mufti of Egypt. And then a table is there which compares the medical recommendations and the religious recommendation as well. It is pretty much in line of what we have just discussed in the previous slide. Now coming to Holy Quran, what we all know that these three verses of Surah Baqarah address fasting. And it is important to see the highlighted section that the one who is sick or is on a journey should fast later on after the completion of Ramadan, the number of days that he or she has missed. And Allah intends to provide ease for you and does not intend to create hardships. Now coming to our Maraja Karam, at Ayatollah Sistani's website, there are two sections where fasting is addressed for people who are unwell. One in the Q&A section, and there's a question that what is the Islamic ruling about someone who is suffering from a disease? How should he go about fasting? And the detailed instructions are in line with what we have just discussed. If fasting can be harmful for such a patient, he or she should not fast. And until the arrival of next Ramadan, there is time to compensate for that. And if somebody is not able to do that, even in that period, then kafara is to be given. Similarly, in the sections of the rulings, Ayatollah Sistani's website clearly mentions that injections and intravenous drips do not invalidate a fast. Therefore, insulin injections can be taken, and if blood test is required, that also can be done. There is also a question of, in the Q&A section from a person that I'm pregnant and would like to know whether I should fast or not. The answer is that in the later trimesters, in the advanced stages of pregnancy, it is not obligatory. And even in the early stages, it is important to evaluate the health. And for all of these things, as it has been mentioned again and again, what we are offering here is education and not clinical advice. You should consult your treating physician before you embark on fasting. Now, as far as injections are concerned, for medical use, all the Maraja Ikram have a universal opinion. They all permit the injections for medical use, and injections for nutritional use or tonics, there is a difference of opinion. Some Maraja Ikram have permitted it, while others have not. Now, in terms of scientific literature, there are many papers around diabetes and Ramadan, and a review has been done for primary care physicians by these clinicians from Boston. And here again, a detailed analysis is given from different schools of thoughts as to what can be done. Eye drops can be given, ear drops can be given, nasal sprays, what kind of examinations can be done, what kind of catheters can be inserted, and all of these things are explained in this paper. This is same topic from the leader.ir website, from Ayatollah Khamenei's website, again permitting blood tests. Now, another question is, what should I do before Ramadan? Should I change my medicines or their doses prior to Ramadan? The most important thing to do before the commencement of Ramadan, and now that Ramadan has started, you can still do it, is to consult your treating physician. With all your key reports, some of the key tests that you should be doing are your sugars, fasting, as well as postprandial. If you monitor your sugars by glucometer, you should take readings for several days, lipid profile, renal profile, and any other test that your doctor has recommended. You should do that and take them to your treating physician and get the advice accordingly. If your sugars are well controlled, then some medicines may require dose reduction. Only a qualified health professional should do that. You should not do it on your own. And then your doctor may also prefer some medications that have lower hypoglycemic risks, like DPP-4 inhibitors, GLP-1 agonists, and amongst the insulins, the second generation basal insulins like Glargine 300 or Degludec could be given because they have a low hypoglycemic risk. Now, if you're on insulin therapy, there are some do's and don'ts. As I mentioned earlier, religion permits us to inject insulin even in the fasting state. We should consult our doctor prior to Ramadan or even during Ramadan with our sugar values to ask them if there is any dose reduction or increase that is required. Because as I showed in the very first slide, both hypoglycemia as well as hyperglycemia are to be addressed in this period. If you are a clinician, you can consult IDF-DAR guidelines, which I just projected on the screen a little while ago. And all patients with diabetes, you should do frequent glucose testing. That is very important for you. Iftar should not be delayed, and suhoor should not be missed by anybody, but especially by diabetes patients. In our community, it is not very uncommon for people to delay their iftar. They will generally, it's seen that in many places that they would offer Maghrib prayers, then the Isha prayers, and then they would break the fast. For diabetes patients, this should be avoided because recently we conducted a study, a worldwide study, in which we noticed, as part of my company, we noticed that in Canada, the number of hypoglycemic events in the population was higher compared to the Middle East, India, Pakistan. And when we analyzed the reasons for that, we noticed that in Canada, the duration of fasting was about 3.5 hours to 4 hours more than what it was. This was 2 years ago. The study was conducted 2 years ago. And then when we further analyzed the data, we found that most of the hypoglycemic events in the Canadian population occurred in the last 2 hours of fasting. So which means that towards the end of fasting is the most critical period for hypoglycemia. And if somebody does have hypoglycemia, which is glucose less than 70 milligrams per deciliter, or if you're measuring in millimoles, then less than 3.9, then the fast should be immediately broken. Another question I get frequently is that all these guidelines and all these recommendations, are they based on research or it's just somebody's imagination? So you would be happy to know that in the last decade or so, a lot of research work has been done specifically in diabetes and Ramadan, both from epidemiological study, what you see here, the EpiDR study, down to a study with different molecules. You have studies with sulfonylureas, you have studies with insulins, with insulin Glargine 300, as well as Degludec, and the GLP-1s as well, and DPP-4s as well. So a massive literature is out there on the basis of which the DAR guidelines have been formulated. These are two studies in which we were involved recently. One evaluated insulin Glargine in participants with type 2 diabetes, and we noticed very low rates of hypoglycemia in this population. This is the one that I was referring to, where relatively in Canada, the number of hypoglycemic events were higher compared to the rest of the population, but still it was low for everybody. And this study is ongoing. The results will be out by the end of this year. Lastly, diabetes and Ramadan practical guidelines. This is a snapshot of what I was discussing about DAR, and it can be downloaded from their website. This thing has already been addressed. This was part of my previous presentation that we did at IMI, but just for a quick recap, please follow your country's guidelines on COVID vaccination. Vaccination is saving a lot of lives. In terms of risk benefit, both CDC and WHO have advised that benefits of COVID vaccination outweigh the risk. So don't go by the rumors that you are hearing. The benefits are still far higher. And in Ramadan, it is permissible to take the vaccine, as another speaker mentioned a little while ago. However, please be mindful that some people may experience malaise and slight fever-like condition after vaccination. In such a situation, it may not be advisable to fast for the duration of malaise and fever. But still, vaccination is important and you should get it and seek your doctor's advice if you are immunocompromised or very elderly. That brings me to the end of my presentation. Thank you very much.
Thank you. Thank you so much, Dr. Mubarak. Those were some common questions I've seen online. So thank you so much for gathering them and putting them together. So once again, I'll share my screen so you guys can see the QR code. We're still taking questions. This is the code. The code is 786 if you want to put in the website, or you can scan the QR code on your phone's device, sorry, your phone's camera. So then we have, after this, we have our Islamic Center of Zahra's very well-respected resident alim, Sayyid Hadi Yassin, here with us today. Sayyid Hadi Yassin completed the Hausa program and went on to obtain 2 bachelor's degrees in Quranic science and Hadith and fundamentals of Islamic law. In 2009, he came to the US and began his master's in psychology, specializing in family and child development. He has prepared a 10-minute speech for us, and I would like to request our respected scholar, Sayyid Hadi Yassin, to come up and present. I'll stop sharing.
Thank you so much. Assalamu alaikum wa rahmatullah. Bismillah ar-Rahman ar-Rahim. Alhamdulillah. Wassalatu wassalamu ala sayyidina wa nabiyyina. حبيب قلوبنا وطبيب نفوسنا أبي القاسم المصطفى محمد. اللهم صل على محمد وعلى محمد وعلى أهل بيته الطيبين الطاهرين. Brothers and sisters, assalamu alaikum wa rahmatullah. First and foremost, I appreciate all the guests, mashallah, and the speakers. Alhamdulillah, great to have you all here, doctors and all those who are active in this field. May Allah, inshallah, bless you and protect all of you guys. And also special thank to organizers, alhamdulillah, for putting this together. It's very needed, very important, all the time, specifically in the month of Ramadan. A few points from the Islamic perspective, inshallah, regarding the fasting and month of Ramadan, which body, mind, and spiritual aspects are all together and are important and soul. Specifically, we have great recommendations from Ahlul Bayt and Manqul from Rasulullah sallallahu alaihi wasallam regarding the fasting and physical and medical aspects of the fasting. One thing is important to pay attention that, definitely what Allah subhanahu wa ta'ala recommends regarding feeling hungry and thirsty, there's not only one aspect of it, which is the spiritual benefit. There are the definitely medical and physical benefit, as mashallah we heard from the doctors as well. Therefore, the month of Ramadan is not the month that I have 2 opportunities in Sahar and in Iftar to eat as much as possible, so I won't feel hungry. No, I should sometimes feel that hungry. However, this is important to understand that these 2 points are not that sometimes some people eat as much as possible during the Sahar, that they can't even go to sajda for when it comes to namaz, or when it comes to iftar, they might even have some physical complication that they can't even continue fasting. There are a few important points, some recommendations regarding the sahar and iftar. As you heard, in Islam, we have very high recommendations about do not miss sahur or sahari. It's very, very recommended to make sure you eat it. However, I'm sure the doctors would recommend this as well. It's not about the quantity, it's about the quality as well. It's about those food that are, are nutritious, are good for your body, and, that helps you a lot. Use those type of things as well, or enough liquid. For the iftar specifically, we have the sunnat, manqul, that they said Rasulullah sallallahu alaihi wasallam, he was always, breaking his fast with either something sweet. If he had a rotab, date, or, if we type this type of rotab date, he was always opening his fast with that. And then And then if he couldn't find something like rutab or date, he was opening his fast with anything sweet. And we have in some tradition even the sugar as well sometimes. Of course, when it says not too much, it's just sometimes it says musamma, just a little bit of that. The other thing that's been recommended is the warm water. That very interestingly is compatible with the science that they're saying as well. With the warm water to open the fast, it's very important as well. Or anything we can say, the tea or water or a liquid here as well. About the type of food, yes, we have the food that's been recommended that has a lot of nutritions in it. Again, in traditions, we have a lot of emphasis on dates. That helps a lot regarding that. In Quran, we have a lot as well. Surah Maryam, about Hazrat Maryam, the same way that when she was after delivery, the date, the palm tree came to her and then was grow for her. Anyhow, that's one thing about do not eat too much. We have recommendation about this. Do not eat too much. That's not recommended as well. Even when it comes to iftar, very light, maybe at the beginning, maybe different levels. And at the beginning, very light. And then a little bit after that, and after that, not too much. Another thing being recommended a lot is about brushing our teeth, miswak, which is very, very important. Although from a fiqhi perspective, it's not wajib. Although someone who knows 100% if I don't floss or wash my teeth, for example, during the day, purposely is going to go down. That's a whole different scenario that I don't think is relevant. But it's very interesting, that it's an etiquette as well. It's recommended to make sure we brush our teeth, specifically at the time of suhoor as well. And the other thing I would like to add here from this perspective is sleep. Enough sleep during the month of Ramadan. We have traditions. I'm just going from more the medical traditions regarding the Ramadan. Otherwise, the spiritual aspects, it was zikr and Quran and sadaqah and charity. These are all definitely part of the recommendations and the mustahabbat of fasting. So I'm focusing more on the physical aspects now, more related to the group and sessions that we have. Sleeping is very important. We have recommendation that first and foremost, after Fajr, all the time, specifically in Ramadan, do not sleep. Make sure you use that time. If you have energy, recitation of Quran, some zikr, or whatever you can. Even if not about that, make sure you stay awake until the sunrise and then go back to sleep. Early in the morning, it's makruh. It's really, really not, it hurts, according to traditions, the mind of the person. Is not good to do that early in the morning. Early in the morning, let's say, for example, 8, 9, 10, stuff like that. It is mustahab to have a ghaylula. Ghaylula is a short nap before Zuhr, around Zuhr, close to Zuhr. And the best time, which from ulama we heard a lot, is al-maraj ulama, half an hour before these azan Zuhr, 45 minutes before azan Zuhr, which gives a lot of energy as well. It is mustahab to have that nap, which throughout the day gives you energy to continue. Sleep before Maghrib is very, very, very makruh and not recommended, which again, it had traditions about, that hurt the memory of insan, that science should go check if not done before. So therefore, it's important to pay attention to get enough sleep from the physical, from the Islamic perspective here as well. Regarding the fiqhi situation, very quickly to point out, there's some differences between maraja regarding the medicine and stuff like that. Of course, anything that will be taken by mouth would make, during the time of the day and the time of the fasting, would fast to make the salat, the fasting and roza batil. No matter if it is for the medical purposes or whatever, the roza is batil. Of course, if it's purposely for no reason, it's haram and kafara comes. But if it is for sickness and stuff like that, there's no kafara. In certain cases, there's only qaza they have to do. When it comes to injections, there is also the differences here as well. Very quickly, Ayatollah Khamenei is saying that he does not recommend any injections that is for nutritions or energy, injections or anything. Totally ihtiyat wajib is haram. You should not use it. And when it comes to medical medicines, if it's to the muscle, not to the vein, it's okay. From Ayatollah Khamenei, not to the vein, the medical aspect. So when it comes to the vein, he does not accept it. Ayatollah Sistani, he's okay with all of these things. Doesn't matter what type of injection is and stuff like that. He said it does not break the fast. So what I heard, and they can say, you know, all those injections that are into the muscles, then they're okay. If it's not from Ayatollah Khamenei about nutrition and energy, but from Ayatollah Sistani is okay. So it is not that difficult. It's just a matter of understanding the ahkam, inshallah. But overall, it is important to pay attention to the physical aspects of our body during Ramadan. Again, the tawfiq comes with, inshallah, we keep ourselves healthy to take the, inshallah, the benefit of the holy month of Ramadan, not to get sick, to be too weak and fatigued, so we won't be able to take advantage of this month and the blessings and ibadat that we have in this month. Therefore, inshallah, if we can make the balance here, specifically, I would like to recommend, and maybe doctors should talk about it, the younger, mashallah, friends that are fasting, maybe those who are first year, the second year, the teenagers, maybe younger one, specifically for our girls, this is the first year, second year, they're fasting. So we have to, inshallah, keep in mind that, make sure we have a good balance for them from the physical aspect and perspective. So inshallah, they will take the benefit from this month as well. I won't take that much time. I know it's more of the, inshallah, alhamdulillah, the experts. So thank you so much for the opportunity, and may Allah bless you all. And inshallah, I pray that Allah subhanahu wa ta'ala accept all our ibadah and fasting. Thank you so much.
Can you hear me? Hello?
Yes.
Yes.
Okay, sorry, I was having a little difficulties. Jazakallah, that was truly an engaging and eye-opening speech. So that's the end of our speeches. So I'm going to open up the floor to our knowledgeable panelists for a Q&A. We have an immense amount of questions coming in. So I'll try my best to get through the questions as many as I can. Oh, quick disclaimer, please remember that the answers to your questions are generalized answers, and it is highly suggested to contact your healthcare provider before making any big lifestyle changes or any changes to your medications. Okay, so the first question we have today is, can I travel to Iraq or Iran for ziyarat if our whole group of Zahirin are vaccinated?
Yeah, I will refer this question to Dr. Waji. Oh, sorry, Dr. Hassan.
I don't think we can hear you.
Right. Thank you very much for an excellent question. So the premise of the question is that that if you're vaccinated and then the group is also vaccinated, right? I think right now, all we know is that if you have completed the vaccination, then that reduces the risk of COVID infection. It does not eliminate the risk. So therefore, I think you have to actually take into account the COVID activity where you're going, because if obviously there's the places are still rampant with high number of COVID cases in like some parts of the world, they're still undergoing lockdown, then I think I would use a bit caution, and because you're going to be in really very crowded conditions. But this is where I think you would use your judgment, because you have to obviously make the decision in terms of what's and you want to take into account the level of COVID in the area that you're going to visit.
I will also request Hadi Yassin, our resident scholar, religious scholar, that if we are fasting and it's related to going for the ziyarat, definitely it's a great privilege for us, But during fasting, if we are traveling, and then definitely there's a chance that we can miss our fast, especially if you're not traveling within, I think, for 10 days. Can you give us your comments? What's your recommendation?
Well, doesn't matter if the ziyarat if it's the purpose of ziyarat or you're going for fun, doesn't matter. So as soon as you become a traveler, of course, you should not continue your fasting. However, you have to wait until you become a traveler. That's the point many people make a mistake here. If you want to leave your house, 100% you're going to the airport and you're traveling, right? You cannot break your fast until you pass the Hadd al-Tarakhus. That's the point. You're going to travel with the car, and then you cannot break it until you, otherwise the kafara comes and a lot of issue happens here. Anyhow, but if someone travels, if either they go somewhere that is they're going to stay 10 days, at least 10 days, that they have to continue fasting. But if not, they have to break their fast. Doesn't matter, Mecca, doesn't matter, what the purpose is, unless certain places that are different. So yeah, that's the point.
And relevant to traveling, again, for Hadi Yassin, that if nowadays we are getting the appointment for a vaccination, sometimes we get the appointment very far away. And if they have appointment in the morning, definitely, as Dr. Hassan and all the doctors, they are encouraging that we should really get the vaccination. Is very important for everybody, for us and for the community. But again, the traveling will be issues. So I don't know, what should we just hold off getting the vaccination appointment if we are not getting afternoon, or what should we do?
Traveling is not haram during Ramadan. If it's not a good purpose, it's makruh, right? Therefore, if they have to travel before Zuhr and they pass the Hadd Tarakhus, they can't fast that day. They would do the, after that, after Ramadan, they do the qaza of that day. But if they can hold it, so they have the blessings of the month of Ramadan, and then they take the vaccine after that, that's fine as well. So overall, traveling is not haram in Ramadan.
Jazakallah. And next question.
Yeah, actually, there was a question related to that as well. It's the advantages and benefits of spending sorry, I don't know how they worded it, but basically they're asking, is the advantages and benefits of spending Ramadan in Iraq at the risk of missing your fast higher than spending it here in a Western country?
Yeah, so yeah, Hadi Yassin,
Can you read again?
They kind of worded it a little oddly. So basically are the advantages and benefits of spending Ramadan in Iraq at the risk of missing your fast higher than spending it here in a Western country? Spending Ramadan here.
From the spiritual perspective, so what we know is fasting is most important things, right? Because fasting is wajib. I'm using my own judgment. Fasting is wajib. So the most important wajib that we have is fasting, that we have to take care of that, inshallah. But anything else, ziyarah is mustahab, let's say, right? So therefore, I would say, yes, the fasting is more important. Make sure at least you don't miss that much of Ramadan. Then inshallah, anything else as well. But other than that, it's just the judgment of the person as well. Yeah.
Okay, thank you. And then, so we have a question for Johnson & Johnson vaccine. It's been said to be developed using human embryos for growth. So is it Islamically acceptable to get this vaccine?
So I would let Maulana Sayyid Yassin comment on the Islamic aspect, but actually this has been quite heavily debated even in the scientific circles, because the current Johnson & Johnson vaccine, the ingredients actually do not contain any human embryo cells. So that's really the important thing, and that actually Reuters has done a clarification on this also, because there's a lot of information going on that it actually contains human embryonic cells, and it does not. So just wanted to clarify that.
And I stay with that answer. That's a great answer.
Right. I think I will also add that one to Dr. Hassan, that yes, we know that it's not that one. And we know this is basically, as compared to Pfizer and the Moderna, which they are using messenger RNA. Yes, they are using the virus, but it's just adenovirus. But definitely, I don't have that. I also don't agree that it's like embryo, something like this. Yeah.
Sure.
It's adenovirus, basically. Yeah.
Thank you.
Yeah.
Okay.
Next.
Yeah, so the next person is asking this to, they wanted to be asked to Dr. Fatima, are air fried pakoras or air fried anything better than something deep fried?
It's a very good question. With the air fryers, a lot of people now, are thinking that they can use the air fryers to get that fried crispy texture, and cut out some of the unhealthy effects with the frying. So it's a two-answer kind of two-part answer. One part is that air frying does cut down your calories by a significant amount compared to deep frying, and you're using much less oil. So in that aspect, it's healthier than deep frying, but it's still fried. It's still considered fried foods, and it's using very high temperatures to make the frying with the air fryers. And also then you may not be getting some of those healthy fruits and vegetables if you're eating a lot of fried foods. We worry about with the high temperatures that you could get some toxinogenic components to the food, so risk of cancer. So compared to deep frying, yes, it's healthier, but it shouldn't mean that it's a healthy, frying in general is not very healthy. So limiting that amount is always a good idea.
Okay, thank you. And then there's another question for you. Is Manuka honey better than normal local honey?
So that also has a two-part answer. So local honey can help with our, exposure to help decrease our risk for allergens and allergies in general, since we're getting the pollen from our local, bees and pollinating the flowers. So local honey is good from that aspect. Manuka honey has a health benefit of being antimicrobial. So it can help with, during the COVID, if you're trying to do some immune boosting, antimicrobial or wounds. They've done studies on wound healing with the Manuka honey that can be helpful. So both have benefits.
Thank you. And then someone else is asking for Dr. Hassan Jafri. What is special about sanitize treatment? I don't know if I said that correctly.
Yeah, no, it is. So sanitize, it's an interesting product that's currently in development. By the way, I tried to focus actually just on the options that are currently approved by the FDA in the US. So sanitize, it's an interesting concept. It's basically nitric oxide, which is a compound that has been recognized to have broad activity against a lot of different viruses. So it's also produced by the body, and it can kill a lot of different viruses. So basically what they've done is they've actually created a spray of nitric oxide. And the idea is that people can actually take it and put it in the nose, and then that could actually be used to help protect. It's a very interesting concept, but like I said, it's not approved yet. But as I'm thinking about it, they're still enrolling patients in the trial. But one of the trials that recently they completed, it was interesting because they looked at patients who had early COVID infection, and they treated them for 14 days with mild COVID. And basically what happened was that they were required to take nitric oxide gargles once a day, and then put it in their nose in the evening, and then take nasal spray 5 times a day. So it seems like it's quite a lot to do on a daily basis for something that's mild, but I think it would be still really good to actually have that option. The other thing that I've noticed, because I'm a researcher myself, and having been in discussions with the FDA and the European Medicines Agency on the trial, the designs, I noticed that right now what they've shown is the first very good step, which is that they've shown that using the spray and also the gargles combined led to reduction of the virus. But typically before a drug could be approved, the agency want to see an improvement in the clinical signs and symptoms of that infection. So I would assume that would be one of the next steps that they would be doing. So I think it's a good start, and looks very attractive in terms of an option that would be easy to do. It would be, of course, like 5-6 times a day, but it still would be a good option to have. But it seems like we're a bit away from it being available to us, but it's being developed, I guess, between Health Canada and UK. So.
Dr. Mubarak, do you have any add on this one? Anything according to your research?
No, that's a very complete answer given by Dr. Jafri.
Thank you.
Thank you. For diabetic patients, what are your comments on a keto diet?
Let me just refer to definitely Dr. Fatmi, please.
Yes, so the keto diet is deficient in carbs, so very low amounts of carbs. And in general, when we're fasting, we need some carbohydrates. So I usually, also the keto diet is very good for short-term weight loss, but they've done studies that maintenance of the keto diet long-term has not been done for a lot of people. So a lot of people, it's hard for them to keep that up. So I usually, don't recommend the keto diet. I think having some carbs, complex carbs is beneficial in our diets. especially when we're fasting. So yeah, I would just be really careful with the keto diet.
Dr. Waji, do you want to add something on this one, please?
Thank you so much, Mustafa Bhai, for the question. I agree with Dr. Fatima, and I would say that there are some studies showing that intermittent fasting, which the Ramadan fasting is a form of intermittent fasting, and it is considered to be superior to keto diet. And I would also say that this is the obligatory fasting during the month of Ramadan, which is wajib on all who can fast. But following in the tradition of our Holy Prophet, the intermittent fasting can continue throughout the year, especially the sunnah is to fast on Mondays and Thursdays. So the benefit of the Ramadan fasting, of course, but the intermittent fasting for a few days a week can continue for the entire year. And it's considered to be better than the keto diet. Thank you.
Thank you, Jazakallah. Next question, please.
Yeah, thank you. Is gargling okay during fasting?
Dr. Mubarak, you want to say something, and then I will ask Dr. Hadi Yassin, according to your research from Rajas.
I think it's better that our alim answers that question.
Jazakallah, mashallah.
All right. So what is important is that you shouldn't drink or eat something, right? You can wash your mouth, you can brush your teeth. Important is that you don't swallow it purposely, right? So if you just goggle it and then you spit out, that's fine. And Al-Char Sistan said it's better, it's mustahab to spit out 3 times. It might help you with the breath and the stuff like that to smell better as well.
I see. MashaAllah, the importance, this question I think is important at this time. The one who has asked this question is really very important. I want to highlight that one, that yes, nowadays we are encouraging for the gargling because of the coronavirus and all this thing, and definitely, but during fasting we have to go according to our Maraj, and whatever our Maulana Hadi Yassin has mentioned that one, please make sure that we don't invalidate our fasting, which is the most important thing.
Thank you. And then for Dr. Hassan Jafri, could you comment on any myths that you have seen about vaccinations?
Oh, there are a lot of myths. No, I think in general, there are things that, what I would suggest is because of social media. I mean, we get so many, pieces that are forwarded to us via, WhatsApp and others, and some just from the very beginning do not make sense. But yeah, I think it's also important to recognize that there's obviously a very vocal anti-vaccine lobby that has been very, very involved and active for many years here in the United States, and we've seen the harms of that in terms of the resurgence of measles, in the United States and in certain parts, and also in Europe as well. So I think that's an important part to also recognize, because some things are, things, where, some of these things are just totally outlandish. For example, which they say that, mRNA will get incorporated into your cells, and then with 5G, your entire body will become a human antenna, and somehow Bill Gates is trying to actually, gather all the information. And some of the, so those things, hopefully people will not fall for. But I can't tell you how many times I've been asked by my family to comment on it, and I try to actually excuse myself, and I say, usually you should ask, another family member of mine who's more knowledgeable in IT, and that's Brother Asim Jafri, because it's an IT related. They're talking about antennas rather than, But I think, seriously speaking, what we see now about COVID vaccine, we've seen the same thing for polio vaccine. We've seen it for mumps, for rubella vaccine, and in general, what we need to remember is that the good thing is that, at least here in the United States, and UK and other places where medicines are developed, there is really a very, very effective and careful process through which any new medicines go through, especially the vaccines. I think there's obviously greater concerns about the COVID vaccines just because how quickly they were developed. But I think as has been emphasized on several times that every time there's been a pandemic, I remember when there was the original SARS epidemic, and then there was the MERS epidemic, and then the Ebola. Every time there's an epidemic, the world is getting better in sharing information. There was a time about 20 years ago that CDC would not share data with the National Institute of Health. They would not share the data with the academics. The academics would not share the data with the pharmaceutical industry. And now I think what people overall the scientific community has become better at cooperating and sharing the data. And I think that has really led to leveraging a lot of lessons learned, and that has led to the speed at which things have been developed. But at the same time, that's why we are still at a slight disadvantage because as I mentioned in my presentation, things like how long would the vaccine be able to provide protection? We don't know yet, because unlike other vaccines in the past that the trials would go on for 2 years, 5 years, and only then the vaccine would get approved. Here, the vaccines were approved under emergency use authorization earlier, but the trials are still ongoing and they're following these subjects for several years. So that's where, and just to give you an example, I myself was enrolled in a clinical trial as a subject, and I had no idea whether I got placebo or I got the active, so that's how this process is really very careful, and they try to eliminate bias. And as we've seen with the Johnson & Johnson vaccine situation, that the system is such that, I'm hoping that each one of the community members, when you go to get your vaccine, you have the option to using your cell phone to enroll in the VSafe system, right? That actually gives you prompts every day to record your symptoms if you're having any fever, others. That's how we collect, and that's how we know of the millions of people who are actually getting vaccinated. Are they having any issues that have not been identified in the trials? Because remember, even the trials, though there were 30,000 people or even greater for some of the vaccines, but they're still not in millions. So when you start having so many people using a vaccine, then that's an opportunity, and that's how we found out that like 6 people out of 7 million have developed the clots, right, of the people who had the 7 million who had received the Johnson & Johnson vaccine. Now, we don't know whether that's true or not, but that's why I think the other thing that gives me comfort is that the CDC and the FDA, instead of saying, it's probably nothing and we'll just keep dosing people, instead of that, they said, no, let's halt the vaccination. Let's do a full detailed investigation, and only then we will determine whether the vaccine should be given to individuals or not. So I think the checks and balances that are placed in the system, that gives me a lot of comfort and reassurance, and I hope that people will remember that as well. But I think this is why it's very important for them to ask the questions to their local physicians and local leaders, because that way they're likely to get more accurate answers rather than relying on the social media. So I'm sorry for a long-winded answer, but I hope I addressed some of them.
Thank you, Dr. Hassan. Definitely, because that's a thing this time we want to emphasize on the vaccination. And this is a current definitely concern for everybody. So I appreciate that you have done. And definitely, again, I will request Dr. Mubarak, especially appreciate that you joined us from India so odd time, definitely, but definitely your expertise, especially relevant to the research, I always respect that one. Anything especially to Indian or Pakistani, especially in that subcontinent, that if you have any advice about vaccination or anything, please, 1 or 2 minutes. And before I just hand over to you, Iba, please try to finish it within 5 minutes. We are actually running a time. I know that you have a lot of the questions. I appreciate our community that they are sending us so many questions and they are taking the interest. And I think Brother Asim, I think we can have that our panel will be there, inshallah, to help you guys If you want to contact us through our emails, other things, we'll be there always to help you. But definitely it will be hard for us to give the answer for all the questions. So Iba, try to finish it after that, just in 1 or 2 questions after that. Yeah, Dr. Mubarak, please.
Yes, thank you. It's been a pleasure. Just a couple of things about vaccine. A lot has been said and emphasized, and nothing to add except the fact that please go and get your vaccines. Don't be guided by rumors, but be guided by your clinicians, the opinion of your physicians. And the second thing is that although Ramadan has started, but still it's not too late if you are diabetic, especially, or hypertensive, or a cardiac, and you want to fast, then it's still a good time to set up an appointment with your doctor. Make sure that you are taking the right medications. Make sure the doses of the medicines that you are taking, especially for diabetes, are the correct ones. And keep monitoring your sugars throughout the day, especially prior to iftar and at the time of suhoor, and adjust your doses accordingly. Thank you very much.
One thing I just wanted to add, that when people ask me how much confidence I have in vaccines, I said, remember, before you get the vaccine, your physicians are going to get the vaccine. So, they're obviously going to take the vaccine first, and they're going to be like a few months ahead of you. So if you're after, when it's your turn, and if your physicians are doing okay, then that should actually give you some confidence, and you can get it. Because me and my entire family, because here in Maryland, now they've opened 16 and above. So my entire family, including my children, we've all been vaccinated, alhamdulillah.
I think that's a good answer, Ted. Very good. Yes, Iba, please, on 2 questions more, please. Okay, Iba?
Okay. So someone sent their question 3 times, and I'm gonna answer because can we just get like a really, really short answer so I can do 3 quick questions? So number 1 is, why should we trust vaccines considering many vaccines have been banned, including J&J?
I hope I've already answered that question. Thank you.
Okay, yeah, so basically, don't go what everyone else is saying online and talk to your physicians. So Dr. Waji, this is for you. This is a question about diabetes mellitus. Can they skip their insulin during lunchtime as they are fasting?
Yes, of course. Since they're fasting, they can skip the insulin during lunchtime. But again, a blanket statement cannot be issued here. It all depends. It has to be individualized. But in general, the answer is yes.
Thank you. And then for Dr. Iqbal, last question. As a young adult, I'm having trouble sleeping. Can you advise on any natural sleeping pills, etc., and how much sleep is adequate?
Thank you so much for the question. Usually 7 to 8 hours is ideal for you to sleep. And if you want to take a natural sleeping pill, you can take over-the-counter melatonin. Maybe 1 milligram is a reasonable dose. And that's a good amount to take.
Thank you. I'm so sorry I couldn't go through all the questions, but as Dr. Mustafa said, you guys can definitely contact them. I'm sure that they have their emails on ICZ's website, or you can contact ICZ for their website. And then we will have Sister Shaibano, who is a BOT member ICZ, for the vote of thanks. Thank you, everyone. The air is full of lots of knowledge and information for us to digest.
Very quick note, and this is great regarding washing the mouth. If some people ask, just make sure that if during the time of Rosa you're washing, make sure you spit out, right? The water that you put in shouldn't stay, so you have to spit out. So in that case, you're okay.
Thank you.
And 3 times is the best.
Sorry, one more question. Someone is really asking me to ask this. So basically, sorry, I lost it. Okay, so basically what the question was, is if everyone in the household is vaccinated except for 1 patient who is at high risk, any comments on that? What are the risks that they should take?
Yeah, Dr. Hassan.
Yeah, so that's a very good question, because typically the way people who are high risk, they get exposed, are typically people around them. So first of all, the high risk individual should hopefully also get the vaccine ASAP, but their protection is, or their risk is reduced by having people around them in the household being immunized, and so that's a very important thing, right? But hopefully the high risk individual should also get the vaccine.
They mentioned they were bedridden, so like they weren't able to go
Sure.
get the vaccination. Yeah.
No, I think if they're bedridden, then of course, in terms of the logistics, as long as people who are, visiting them, they're vaccinated, then that should, hopefully reduce, any, would not eliminate, but would minimize the chances of their exposure. But, because people usually get it from someone else. So,
Mhm.
but remember, with vaccines, what we are seeing is that you can have breakthrough infections. So it's not that if I have received the vaccine that I may develop mild infection. It may still be enough to pass it on. So people still have to, so maybe something to think about is that if I'm having some symptoms, then I should still use the gown,
Mask.
like a mask and gloves. Yeah, thank you.
Yeah, definitely. I will just add on within less than 1 minute that the vaccination is very important. Again, we all emphasizing on that one. We should get all vaccinated, but make sure that the vaccination, it definitely prevents you to getting more serious illness. But definitely studies have not proved that you are not transmissible. You can transmit the disease. So it means that you can have the virus and you can transmit somebody and who is of high risk already. And if they get that virus, they are not protected because they are not vaccinated. And you are definitely protected again. You don't get illness, but as you can transmit the disease, so it's mean yes recommendation that that everybody should be vaccinated. You cannot spare one person that if you think that everybody is vaccinated, the other person is safe. No, you can give that disease to the person who is not vaccinated. So please, definitely recommendation is everybody should be vaccinated. Thanks.
Thanks.
So yeah, thanks. Sorry for taking time more and more. Yes, please.
Yeah, so thank you. Bottom line is we should all get vaccinated as soon as possible. Mrs. Sharbano, I will request you to do the vote of thanks.
Absolutely. As-sihatu afzalun ni'am. Good health is the best blessing. Alhamdulillah, to a great healthcare session, an amazing lineup of panelists offering such interesting and invaluable observations and backed up by Hujjatul Islam Sayyid Hadi Yassin's reinforcement of the same. I thank you all for your time today, professional expertise and religious guidance. Very enlightening question and answers. Thank you all for attending and posting those questions. And I'd like to conclude on a powerful take-home message. A fit body and a calm mind cannot be bought. They must be earned. And before I close, I'd like to request you all to recite a Surah Fatiha for the beloved mother of Brother S.M. Kazmi, Sayyida Habiba Kazmi, who passed away this morning.
Jazakallah.